So what we focus on is actually active individuals out in the field. So we have community liaisons that are employed by our organization, and they develop not only community relationships, but they hold education and training seminars out in the Latino community. In many cases, some of our staff are actually have been raised in the Philadelphia Latino community, or Spanish speaking, know the culture and know the environment of these communities well, and as a result are able to engage local community leaders more readily. Really what we predominantly focus on is training and education, because Medicare Advantage is extraordinarily confusing. So this is the complication, and this is what we do, and so I'm going to walk through it. It's going to take about 5 minutes to do it appropriately, maybe a bit more. So stop me if I get confusing at any point. So Medicare, as we know it, is a federally provided, subsidized program for individuals 65 or older. There are some exceptions. Individuals that have disabilities can apply as well, and do ultimately qualify for Medicare as well. If you're below the federal poverty limit, you also qualify for Medicaid. So individuals could be on Medicaid and also Medicare at the same time. We call that subset of the population dual eligible. So they're dual eligible for the Medicare and the Medicaid programs, and as a result they get benefits from both programs, and those must be coordinated across. The traditional Medicare individuals, though, that aren't necessarily qualifying for reasons other than age, will begin to qualify for the program at 65 years of age, at which point they can choose a Medicare Advantage insurer like ours. It's called MAPD, and MAPD programs offer better benefits than traditional Medicare at little to no premium beyond the Part A and the Part B premiums that people pay out of their Social Security checks. So our members are still responsible for their Part A and Part B premiums to the federal government, but beyond that we provide better benefits in addition to traditional Medicare at zero premium to a small premium. It really depends on the product and the level of benefits. What we mainly do is we buy down cost shares, so co-pays, co-insurances, deductibles. We also wrap in Part D benefits. So one of the major things not included in Medicare, the traditional program, is pharmacy benefits. That's called Part D. And Part D is excluded from the federal government's program. So by purchasing an MAPD product at a low to no premium, you're getting better benefits, lower cost shares, and pharmacy benefits, which are not included in your traditional Part A or your Part D, or Part B, excuse me. So